Okay, so let's start with the class for composite restoration. Now, generally, depends on the exam. Sometimes you can get a bit more close to the gingival. Like sometimes I've seen people get equiginger as well. But what I would personally tell you is that practice with a bigger defect. If you practice with a smaller defect, it's easier to do it. So it'd be a good idea to do it, even try it with the gingival as well, that this one's landing, the defect's going more gingival. The bigger the defect, the difficult to do it. And once you have practiced with that, you can easily do the smaller ones. Now, you get a very clean cavity in ADC, so don't need to worry about, oh, if I get the cavity bad. No, you get a very clean cavity. What you need to do is just some retentive grooves, like a millimeter or two. Nobody's going to take a composite off and see it, but this is a good just in case a composite falls on anything. Generally, it does not fall, I've never seen. But yeah, good idea to do these, especially in the exam. When you're practicing at home, you don't necessarily need to do them because it's hard for you to take the composite off. But generally, yeah, these exam point of view, if you can see these sort of like retentive groups, good idea. So if you see, it's a fair bit of defect that I've done. Now, composites, I'll show you as we discussed previously, they can be done in 5 different steps. You can either use completely flowable, that I'll be showing you, or you can use with packable. And then depends on your comfort level. You can either say that, okay, I'll do the first 2 steps with flowable, remaining with packable, or I'm gonna do the first 2 steps and skip to all the 3 remaining steps in one go, like I generally do it in 3 steps. Or you can say I'll do it in 5 different steps, or you can do it in one whole together. At the end of the day, my point or my aim is to show you all the techniques, and then it's your choice, whichever suits you. From your comfort level, you do it. So armamentarium wise, you just need a bit of probe. Okay, you need 1 ball burnisher, flowable composite or packable, whichever you want. Let me show you with flowable first, and then we can discuss. I'm happy to show you with the packable as well. All right. Now, the most important thing with this is the positioning. Now, what we have discussed is if the defect is on the mesial, you bring the strip, mylar strip, from the other side. A lot of people do flowable composites. I've made a detailed video on YouTube about this as well, like this. Now, there's nothing wrong with it, this technique. There's nothing wrong with this. You can do it with this, again, depends on your comfort level. But what I have seen is that in this technique, you have to hold the mylar strip at all times, and the flow that it comes, the curvature is not that great. Again, if you're comfortable, feel free to do it. What I prefer to do it, and I learned this from someone as well, that you go from the other side. Like that. And then wrap it around. Just like that. And I personally feel doing this way, you just get the curvature a bit better. Now, again, at the end of the day, if you feel that, no, I prefer that technique, feel free to use it. There is nothing right or wrong that I've learned in the past years. Whatever works at your hand, feel free to do it. Okay, and we'll definitely need a wedge. Okay, so the most important thing to understand is that a lot of people, when they're doing the class 4s, the main error is that that ridge that it forms, that is deficient. It's more like a flat. So what you need to do is your finger placement will guide you. Your finger should guide you until you see like a smiley there. Okay, you should see like a smiley with that when you see from the incisal edge there. So what I generally do is you turn this and then hold it with the probe, hold it with your finger, sorry, and then run this probe up and down. When you run this probe up and down there, that's the time you start to see that smiley. Can you see it? Start to see that ridge shape is coming. Now, if you leave your finger, what happens? It goes away. So what you need to do is you place the finger, support it with the thumb, get that ball burnisher flowing, get that ridge shape. And then to retain it, because as soon as you leave your finger, it's going to go away. What you need to do is you put a wedge. When you put a wedge, then it stays there. This wedge is too small. But generally, yeah, if you have a good wedge going, let me just see if I can score it a bit better. Push it a bit better. See, now it stays. And that's why wedging is important. One is it will prevent the flowable going gingivally, so you don't have an excess. And that's what we discussed, right? Your mylar strip placement and the matrix band placement is directly proportional for your excess contact overhang. If you have a placement good with the mylar strip and finger placement great, and the matrix placement that we discussed, we will be discussing the complex composite good, then you shouldn't have these kind of problems. Okay, so because I'm doing in steps, I don't really need to worry about flowing in or holding the buckle. I'm just worrying about the palatal at the moment. Okay, so what I need to worry about is only and only just the smiley going, and just so I can get the ridge positioning. I'm not sure if you can see it. Hopefully you can see it better. Can you see that this goes like, we need the ridge going, and that's all I need initially. So whether you hold this or not, if you see my palatal, it doesn't matter. And because I'm doing in 5 steps, even if I hold it, doesn't matter. Once I have the wedge in place, all I need is just to get that ridge going, and then your finger stopping. So then your finger doesn't move. Beautiful. Now what we are gonna do is, I will be the one thing I made sure when I was developing this course, that I don't want to impress anybody with my skills. I want to make sure that whoever is doing this course understands the foundation, the basic learning, the basic principles when we do any restoration based tasks. Either you are a dentist, either you are a fresh graduate, either you are a dental student, or you are an overseas dentist doing some overseas dental license exams. You need to get the foundation right. There's times that we understand and realize that fancy dentistry doesn't work. It only works when you have your basics right. And that's the main aim of my course, is to make sure you understand the basics, the foundation, the basic principles of how to do a composite restoration. Either it be an anterior one, either it being a posterior one. And these both will be covered in that. You will be getting in the next video the concept of functional 6, which gives you an idea why and when do we actually say that this is a good work or this is an excellent work. But if it's an exam scenario, I'm not going to pass you. It's a straight fail. Class 4 composite, but finishing it off, you don't have any contact. What to do at that point? Will you just repeat the whole composite? Can you repeat it? Do you have enough time? So that sort of like stressful situation when we don't know what to do, you should know how to redevelop that contact. What's the skill required? How easy it is, how difficult it is, and how can you do it? By multiple times practicing the technique I'll be sharing with you. But this technique is so useful that you'll be amazed how amazing it is, how it blends in beautifully once you finish the composite. So we get the theory section, we get the hands-on virtual training session for both the anterior, both the posterior composite, but before we start, we get a bit of a foundation, which is the main element of my course, to make you understand what is the basic requirement of doing this composite restoration, for you to be able to say that this is a pass or a fail, does it actually fit in the criteria of a restoration to be called as a restoration? And then we talk about fancy dentistry. Majority of the time you'll see that a lot of clinicians initially they have learned these basics first. Once your hand develops to that level, then you proceed with doing as fancy work as you can. But if you never learn this basic foundation, no matter what you do, how good your hand skill is, you can never get it right. Either it be your clinical scenario, either it be in the exam point of view.